NEXTGEN Office Electronic Health Record is a completely cloud-based scheduling, patient portal, and electronic health record at the very least. We also offer revenue cycle management services and a practice management software you can use, completely integrated and built with NEXTGEN Office Electronic Health Record. Right from patient registration, NEXTGEN Office Electronic Health Record allows your staff to, instead of manually registering patients, run insurance eligibility requests, which at a minimum could require just an insurance ID or the patient's first name, last name, and date of birth. Within a couple seconds, your staff can see with a new patient whether or not patients are active and eligible, their plan information at a glance, and more details under Select here. Then from here, they can easily click Create Chart, with the software then register the patient for them, avoiding your staff having to type in the demographics and human errors that can get claims rejected. Then, when your patients come into the office, your staff can even know a day ahead of time whether or not they are even eligible for services, because our software is a completely integrated clearinghouse. So before appointments, we can let you know, hey, patients are active and eligible. These patients all have their insurance. Or, hey, Joe Johnson here no longer has his insurance. So your staff can very easily contact patients before they walk into office to get the correct insurance information on file. Then when it comes to actually managing your schedule, really simple. You can have a week view where we can see one provider's schedule for a week, or a day view where we can see multiple provider schedules for a single day. And even rescheduling is simple with our software. Simple click, you can drag the patient down the same day to reschedule them, or you can put them on a clipboard, jump them a couple weeks at a time to reschedule them as well. Then, when patients come into the office, or even before, your staff can direct them to the patient portal, where patients can very simply log in on their smartphone, a tablet, or any device. With the patient portal, your patients have plenty of different options, from viewing the current charges, reviewing their medical records, or even checking into their appointments. But most staff, what they try to do is encourage patients to do this check-in, where you can have patients fill out intake information that flows directly into the medical record. And if your patient doesn't speak English, there's 70+ languages that we can translate the patient portal into. So a patient can fill out all their intake in Spanish, but you would see every single response in English. Then, at point of care, the doctor and the EHR can very easily see their scheduled appointments for the day. You might notice there's big buttons. NEXTGEN Office Electronic Health Record is built and designed to work on tablets and iPads, as well as desktops and laptops. Then, when it comes to the charting, really simple. We start an appointment, and we can see this very easy silk menu on the left side. And one of the best parts about the software is throughout the charting, we give providers options. If they want to type or dictate, there's always a note section where they can type or dictate directly in. Additionally, if they don't want to type or dictate, you can easily have clinicians and providers use touch buttons, where I could say my patient's coming for, say, a cough, and then say, well, it's been on for 2 to 4 weeks. And if there is some sputum, that sputum's green. It's all day long, and there is a fever. It's 101. And right here with the touch buttons, these are the same questions that if a patient were to jump into the patient portal, they could complete for you. And then the clinician, whether it's an MA, a nurse, the provider themselves, can very easily review this information and add it in. Then regardless of how you chart, whether you talk into the software using dictation, type using a keyboard and mouse, or touch the buttons, it all ends up giving you a nice detailed paragraph output. And you can always do a note from scratch. So another nice part about the software is you can use templates. And the software will come with built-in templates day one, but you also can build your own library. So my patient is coming for a cough, I can go to Grand Central, say, hey, it's a respiratory issue, import my template. It then imports all of my charting, and I just navigate to the sections in the note to make changes specific to that exact patient today. And one of the best parts of the software is we do work with tablets. So we're seeing a patient and maybe they have a rash or a wound. You can always go to dermatologic body system website, document it. There's also a mountain symbol. You can pull up anatomical images to mark up an image of the foot, or even import an image of a patient's wound or rash, attach that directly in, and even mark that rash or wound up as well. And need to meet government requirements? Not a problem. For the macro program and the mixed program, you'll see over here the health maintenance alert. So as you're charting for a patient, we'll very easily alert you of measures that you are passing with green check marks, with X's for measures you are failing, and the blue hyperlink brings you to the exact section of the software where you need to close out that measure. Then, if you're not just worried about the day-to-day, not a problem. There's a little speedometer symbol here on the left side. So you can very easily see how well you're doing for the entire program, even jump into a section like quality measures to find the exact measures you're failing. One of the best parts about NEXTGEN Office Electronic Health Record is everything's integrated. So whether you are trying to meet government requirements, see patients improve their health care, everything you need to run your office is built in. And like we mentioned in the beginning, you can get the electronic health record scheduling in the patient portal alone, or it all comes built in with all the billing workflows you would need and reporting you'd need as well. If you have any questions, feel free to contact NEXTGEN's team to get a live demonstration customized to you and your practice.